The prostate, a part of the male reproductive system, is a little walnut-sized gland present just below the bladder in men. The prostate gland covers the upper portion of the urethra, the tube that carries urine from the bladder to the outside of the body. The prostate's main job is to make the fluid that feeds and moves sperm. Cancer that develops in the prostate gland is referred to as prostate cancer. It is one of the cancer forms that occur most frequently. Most prostate cancers grow slowly and stay in the prostate gland, where they are unlikely to cause significant symptoms or problems. They could not even require any treatment, or it might be pretty minor. On the other hand, the different kinds are more dangerous and need medical help immediately. Most treatments for prostate cancer are likely to work when the disease is found early and is still contained in the prostate gland. Now, what exactly are the potential causes of prostate cancer? 3 well-known factors increase one's likelihood of developing prostate cancer: age, family history, and race. The likelihood of developing prostate cancer significantly rises with advancing age in men. Men over 65 accounts for roughly 60% of prostate cancer diagnosis. As you hit the middle years of your life, having a conversation with your physician regarding PSA testing for prostate cancer is extremely important. Prostate cancer is the most heritable of the significant cancers. Genetic factors contribute to the development of 58% of cases of prostate cancer. There is some evidence that a man is more likely to get prostate cancer if a close relative has already been diagnosed with it. African men have around a 75% higher risk of developing prostate cancer than white men, and over 2 times the risk of dying from the disease. The reason for this disparity is not fully understood by researchers. Now that we have that out of the way, let's talk about the signs and symptoms of prostate cancer. Most of the time, symptoms of prostate cancer don't show up until the disease has gotten so bad that it puts pressure on the tube that drains urine from the bladder out of the penis. Until this point, prostate cancer typically does not cause any discomfort. The following are some of the possible symptoms of prostate cancer: having to go to the bathroom more often, repeatedly in the middle of the night, having to run to the toilet to urinate, having trouble starting to urinate, hesitating or taking a long time to urinate, feeling like your bladder isn't completely empty, having blood in your urine or sperm. These symptoms do not necessarily point to the presence of prostate cancer. The non-cancerous condition known as benign prostate enlargement causes the prostates of many aging men to swell and become more prominent. Pain in the bones, back pain, appetite loss, testicles, and weight loss that is not intentional are all indicators that the disease may have progressed. Here, please understand that different people have different symptoms of prostate cancer. It's possible that you won't need treatment even if you do have prostate cancer. Your doctor may recommend either watchful waiting or active surveillance if the cancer is in its early stages and is not causing any symptoms. Your age and overall health will determine which option is ideal for you. Both choices require you to keep a close eye on how you feel. If caught and treated early, some men can cure prostate cancer. Some treatments include surgery to remove the prostate or radiotherapy, which can be done alone or in combination with hormone therapy. In some cases, the cancer isn't found until it has progressed to a later stage. Assume the cancer has spread to other body parts and cannot be treated. In that case, the therapy focuses on easing symptoms and extending the patient's life as much as possible. Benign prostatic hyperplasia, or BPH, is an enlargement of the prostate that is not cancerous. Because the urethra goes directly through the prostate, growth of the prostate in BPH squeezes the urethra, which makes it difficult and often unpleasant for men to pee. People often think that having diseases of the prostate that are not cancerous will make it more likely that they will get prostate cancer. But this is not the case. Prostatitis, a prostate infection, is men's most common cause of urinary tract infections. Most treatments for prostatitis are meant to ease the condition's symptoms, which can include a fever, chills, burning when urinating, or trouble urinating. There is no evidence that either of the following conditions increases a man's risk of getting prostate cancer, even though they can cause symptoms very similar to those of prostate cancer and should be checked by a doctor. It has been suggested that high sexual activity or frequent ejaculation may raise a person's risk of developing prostate cancer. This is not the case. Studies have shown that males who ejaculate more frequently may have a lower chance of developing prostate cancer. People used to think that a vasectomy made a man more likely to get cancer, but this idea has been disproven in recent years. Recent studies have shown a link between taking aspirin regularly and a 10 to 15% lower chance of prostate cancer. On the other hand, it is not recommended to take aspirin to prevent or treat prostate cancer. No clear link between drinking alcohol and having a higher chance of getting prostate cancer has been found. The golden rule here is to pay attention to the early symptoms. If you found this video helpful, please give us a thumbs up and remember to subscribe. Thank you.